Is it possible to reverse fatty liver? Fatty liver is a condition which millions of people have worldwide, and many of them would not even know that they have it. I'm Dr. Rawat, a physician who studied nutrition at Harvard, founder of weightlossgroupcoaching.com, and currently writing a book titled Lose Weight, Reverse Disease, and Slow Aging. First of all though, what exactly is fatty liver? It is important to understand fatty liver so that we can understand how to reverse fatty liver. At a basic level, fatty liver is exactly what it sounds like: excess accumulation of fat in the liver. It is normal for the liver to have up to 5% fat, and if there appears to be more than 5% fat in the liver, then that is described as fatty liver. In some clients, this would be found as increased echogenicity or shininess of the liver on ultrasound. In other clients who may have more advanced disease, perhaps grade 2 or grade 3, they would also see elevated liver enzymes in their blood result. Now, it is normal to have a low level of liver enzymes present in the blood test, but if there is a higher than normal level of enzymes, that means that there is active damage taking place to the cell membranes of the liver cells, which is toxicity or poisoning by the surrounding fat cells, also called lipotoxicity, which is causing there to be leaking of enzymes into the bloodstream and hence a higher level of liver enzymes within the bloodstream. Fatty liver has now in fact superseded alcoholic liver disease as the most common cause for liver transplantation in the Western world. However, the most common cause of a person with fatty liver dying is not liver disease. It's in fact heart disease, and that's why fatty liver is so important. It is a harbinger of possible bad news, possibly decades down the line. Fatty liver for most clients will be a sign that you are predisposed to metabolic syndrome. For a full understanding of metabolic syndrome, I would encourage you to watch some of my other videos, but in a nutshell, metabolic syndrome is caused due to excessive storage of fat at ectopic sites, which means unsafe or unhealthy sites within the body. It is quite safe for the body to store fat under the skin in the subcutaneous layer. However, depending upon genetic factors and other factors, varying populations will have a varying degree of tendency to store that fat not under the skin, but increasingly in sites which are more metabolically damaging for that client, causing more inflammation and damage to the surrounding tissue. And that could include the liver and also the pancreas. This can be the gateway into other features of metabolic syndrome, including insulin resistance, type 2 diabetes, prediabetes, heart disease, circulatory disease, PCOD, etc. So if you have been diagnosed with fatty liver and your physician has said to you, well, it doesn't really matter because most people have it these days anyways, I would urge you to not take it lightly. Your physician may not be that interested because for the most part, there isn't really very much medication that we can give you for fatty liver. But from a lifestyle, nutrition, dietary point of view, there is a lot that you can do to reduce your risk of liver disease progression, but more importantly, to reduce your risk of morbidity and mortality from cardiovascular disease, which means heart attacks, strokes, circulatory disorders down the road, perhaps even several decades down the road. But bear in mind, the top 3 causes of death in the Western world are: number 1, cardiovascular disease, heart attacks and strokes; number 2, cancer; number 3, neurodegenerative diseases. And if there is a sign that you could be at risk of cardiovascular disease in the future, then anything you can do to minimize that risk is a welcome step in the right direction. Now let's discuss how to reverse fatty liver using a scientific approach. This is a randomized control trial testing the effects of weight loss on non-alcoholic steatohepatitis, also fatty liver disease. In this study, they found that a lifestyle intervention program which produced 7 to 10% weight reduction had significant improvements in liver chemistry and histological activity of non-alcoholic steatohepatitis. And so their conclusion was that aiming for at least a 7% weight reduction would be a good target or goal when you're trying to reverse fatty liver. On this table, they compare the control group who did not lose weight to LS, which is the group where they did lose weight. There were 10 people in each group, and you can see on this graph how the active group lost significantly more weight. They had a reduced waist circumference. Their liver enzymes, including ALT and AST, came down significantly. Their glucose levels as well as 3-month average sugars came down. Their marker of insulin resistance, HOMA-IR, came down, and the circulating levels of insulin also came down. And this was achieved with a 7 to 10% weight reduction. This study investigated whether a restriction in dietary calories, fat intake, and also iron intake would improve markers of non-alcoholic liver disease. And after 6 months of this diet, they did report that there was an improvement in NAFLD in those who reduced calories, fat, and iron in their diet. This is a study done in women with polycystic ovarian disease and fatty liver. It was done for a period of 8 weeks, and they compared a relatively high dose of omega-3 fatty acids, 4 grams per day, to placebo. And they were able to demonstrate that by giving 4 grams of omega-3 fatty acids, in just 8 weeks, they saw a reduction in liver fat content, also a reduction in triglycerides, systolic blood pressure, and diastolic blood pressure as well. It has long been known that alcohol is toxic for the liver. There is increasing evidence that fructose can also have similar dangerous effects for the liver. It's very important, however, to be nuanced about this. Fructose is what we associate with fruit sugar. Now, bear in mind, the primary pathology in fatty liver is excessive fat deposition in the liver, and that happens primarily because of excessive energy intake relative to the amount of energy that you're taking out. So if the calories in, calories out equation is out of whack, then you will be more predisposed to fatty liver, particularly if you have a genetic tendency to store fat at ectopic or unsafe places. Bearing that in mind, it's important to appreciate that fruits are one of the most nutrient-rich and non-calorie dense food that you can have. Typically, a fruit will have anywhere from 150 to 600 kilocalories per volume, and that is a very low density of calories. That's because they're also packed with fiber, with water, and they have many more benefits, including antioxidants, flavonoids, polyphenols, phytonutrients, etc. And when you have an inflammatory condition like fatty liver, then you will need all of those antioxidants and phytonutrients to help you stave off the damage which is being done by the excessive fat in the liver. So eating fruit in itself is beneficial for clients with fatty liver. Now, if you've seen any of my other videos, I do recommend that we should be eating in a circadian fashion. I do recommend that we should observe a 14-hour fast at least, which would be in the later part of the day. And I do also recommend that you should be having most of your sugar and carbs early in the day. So with breakfast and lunch, while your evening meal, which hopefully will also be paired with some resistance exercise, should be a high protein meal. However, on the whole, fruits are really healthy for you. The problem lies with fructose, which is artificial or ultra processed food containing fructose. So anything which is made from a fruit but is not actually a fruit, in which the food matrix has been broken, the water has been taken away, the fiber has been taken away, that is a high calorie dense, nutrient poor fruit substitute or fruit product. And whether that is fruit juice, fruit jam, fruit marmalade, fruit ice cream, for patients with non-alcoholic fatty liver, those are like alcohol, more or less. So just like you would be having alcohol on a cheat day, perhaps once a week on a Sunday, you should have a similar rule for those kinds of fruit products as well. However, not for actual fruits. This was a mouse study in which they demonstrated that giving genetically modified mice a high fructose diet resulted in fatty liver and also significant fibrosis or damage within the liver. In this rat study, they demonstrated that rats with a fructose-rich diet would have raised triglycerides and fatty liver, and this could be counteracted with exercise. This is a study which examined the use of atorvastatin, which is a statin, a cholesterol-reducing medication, along with antioxidants vitamin C 1 gram and vitamin E 1000 IUs per day. The dose of statin was 20 milligrams of Lipitor or atorvastatin versus placebo. There were 1,005 men and women aged 50 to 70. This study went on for 3.6 years, and they divided them randomly into either receiving the Lipitor 20 milligrams with vitamin C 1 gram and vitamin E 1000 IU or placebo. At the end of the study, in about 4 years' time, there was a statistically significant reduction in progression of non-alcoholic fatty liver disease, and this was in the order of about a 71% reduction in those who used the strategy of reducing cholesterol with 20 milligrams of Lipitor with vitamin C 1 gram and vitamin E 1000 IU. Vitamin E up to 1000 IU per day can have some beneficial effects for the liver, and these are foods which contain more vitamin E. You will notice that these are mostly seeds, nuts, green leafy vegetables like spinach, cruciferous vegetables like broccoli, and fruits like kiwi fruit. Excessive vitamin E has been associated with health problems, so it is important that anyone who decides to supplement with vitamin E should not go over the maximum RDA limits of 1000 IU per day. So what are the kind of foods which can help for liver health? These would include black coffee, green vegetables, beans and soya, fish, whole, steel cut or 5-minute oatmeal, nuts, turmeric, seeds, polyunsaturated fats like olives, garlic, being active, exercising, reducing weight, maintaining low cholesterol levels, and also maintaining low sugar levels. Foods which should be avoided in clients who have fatty liver include alcohol, added sugars, fried foods, excessive salt, processed carbs like white bread, white rice, pasta, and red meat. So as you can see, the primary goal to reverse fatty liver is to lose weight, aiming for 7 to 10% weight loss. Now, you're probably thinking, well, just a case of calorie in, calorie out, fix the energy balance, improve exercise, reduce the intake of calories. But could there be an additional benefit of intermittent fasting on top of calorie restriction? That was also examined in a study. Of course, as we had seen in previous videos, there have been studies, one done by Courtney Peterson's group comes to mind, in which they showed increased fat burning overnight in those clients who had dinner early and also those who had a lower amount of carbohydrates in their dinner to allow for more fat burning to occur overnight as the blood sugar levels came down. This is the study in mind, and I'd like to point out this is a high quality study. It's called a crossover study, which means that the same group of people were the control group as well as the active group, which means those same group of people followed standard care, in this case was dietary and exercise advice, then switched over to time restricted fasting, and then moved back to standard care. So in a crossover study, you can get over a lot of potential confounders which could be related to other environmental factors, genetic factors, etc. And the findings of the study were quite remarkable. Both time-restricted fasting as well as a standard diet and exercise routine were effective in decreasing body weight, improving leptin and adiponectin levels. However, at a similar level of weight loss, time-restricted fasting was superior at targeting the fat within the liver and the fat deposited around the belt line. And this superiority was seen even after factoring in the calorie restriction. I would encourage you to watch my other video titled Best Intermittent Fasting Diet Plan, in which I describe my own intermittent fasting plan. I wake up with sunrise and I have breakfast 1 hour after waking up, and I ensure I have a 14-hour fasting window prior to that. So depending on what time I go to bed, I would be stopping eating 3 to 4 hours before going to bed, and I would only have water, lemon water, green tea in that time period. I would also ensure that my last meal of the day, which typically would be 4 to 5 p.m. in the evening, would be a low carb and high protein meal. And I always make an attempt to match it with a good session of resistance training so that I can have the body prepare rebuilding muscle creation mechanisms active in the evening and night time, while I can have most of my carbs when I'm active doing stuff in the morning and during lunchtime. So what are the top 5 tips for reversal of fatty liver? Number 1, you need to lose weight, reduce calories, increase exercise, and include an element of ATRF or early time restricted feeding, mild version of intermittent fasting. If you have a lot of fat to lose, then you could extend that fasting window further, but only do it backwards. Make sure you have a good breakfast. Breakfast is the most important meal of the day, and if you want to pull that dinner earlier and earlier, that is a more healthy way of doing fasting than doing what most of the people do, which is skipping breakfast, which is not healthy. I will be making more videos about the dangers of skipping breakfast, including increasing sugar levels, impairing the second phase insulin response, etc. But that will be for another video. Number 2 would be to reduce fried foods, red meats, and saturated fats. That also includes butter, ghee, etc. Number 3 would be to reduce refined processed sugars and grains. That includes white rice, white bread, white pasta, but particularly includes fruit juices, fruit jams, marmalades, and any refined processed food which is made out of a fruit and contains fructose. Number 4 would be to increase polyunsaturated fatty acids as well as antioxidants and anti-inflammatory aspects of your diet. And I have a whole series of other videos describing that, but primarily fish, nuts, seeds, olives, avocados, fruits and vegetables, spices like turmeric, etc. And finally, consider supplements such as omega-3 fatty acids, vitamin E, and vitamin C. I hope you found this video useful. If you did, make sure you like the video, subscribe to the channel. If you feel someone else could benefit from this information, then do share this video with them as well. If you'd like to subscribe for one-to-one weight loss coaching in a group Zoom setting, then consider visiting my website weightlossgroupcoaching.com. I am writing a book on how to lose weight, reverse disease, and slow down aging. That'll take a few more months, but until then, I will see you in the next video. Are you tired of endless weight loss and weight regain cycles? Do you finally want to make that permanent, lasting change? If that's the case, I've got fantastic news for you. I'm Dr. Rawat, a clinician with over 25 years of experience who studied nutrition at Harvard, founder of weightlossgroupcoaching.com and the Set Point Reset diet plan. The reason that crash diets don't work in the long term is because you haven't hormonally reset your set point. Your metabolism slows down and your body fights you to get back to the old weight. So before you subscribe on that next crash diet, click on weightlossgroupcoaching.com, and over 8 Zoom group video sessions, I will coach you on how you can use various strategies to hormonally reset your set point so that you not only lose weight, you also maintain your weight loss. I look forward to seeing you there.